Well, people have been telling me since I've been here almost 2 years now that they don't quite know where the organisation is going. So what 2021 fundamentally does, it says this is how we as an organisation can fit in with a different Lincolnshire in terms of health services. That's the 5-year plan for Lincolnshire called the STP. And we can find a path that means we have sustainable services and they're affordable services that staff members, their families and the public will be proud of. It doesn't nail down every single detail. It provides a framework to work within because we want our staff and patients and the public to fill in like a canvas, fill in the bright colours. So one of the biggest areas of concern for the staff and the public is the sustainability of all of our sites. It's something that people come to us all the time, either very politely or very explicitly. They say, we feel salami sliced, we think that we're going to have less of a future. And what the 2021 process does, it says that we believe our sites have a strong and vibrant future. It may be different, but we believe we can provide care to patients in an affordable way and a way that delivers the standards that the public, the Care Quality Commission and our staff would like to deliver.
I don't think it'll be significant remodelling of services. I think what it is, it's more about working with organisations in Lincolnshire to really build on and enhance current services. I think there'll be huge benefits to patients. I think there'll be some practical positive changes. I think there'll be shorter GP waiting times. I also think that cancer diagnosis will be faster as well. I think for STP to be successful, I think it'll take everyone to get involved for it to work. We are a community. For a personal point of view, education is very close to my heart, and I believe that there will be many rewards for staff to develop their own skills with result of STP.
I think it's important because the strategy gives us a structure for how we continue to develop and deliver our services and aligns to the wider STP aspirations of the county. I think it's important that we change to ensure that we have evidence that we're meeting the needs of all people in the county in a structured and coherent manner. I'm really encouraged that as we've written the 2021 strategy, we've underpinned each of the work streams with an equality analysis. This gives us the evidence that we are meeting the needs of people protected under law and making sure that we're not, even if inadvertently, discriminating against them.
I mean, we live in very financially challenging times. It is very important that as doctors and clinicians, we provide leadership in providing good, safe, quality care in a cost-effective manner. I mean, in this brief interview, what I would like to talk about is one of those interventions which we are trying to put in, which should provide this sort of quality care, which is the emergency flow concept, which hopefully should reduce the length of stay, improve our quality of care. Most importantly, it should increase capacity for our orthopedicians and surgeons to reduce the trust deficit. And that is part and parcel of our ward reconfiguration. This has been tried and tested in many other outstanding trusts, and we are hoping it will provide the same results here. And I am very convinced that this will reduce the deficit of our trust.
Advanced clinical practice is where we develop practitioners, be they nurses, allied healthcare professionals, which include physiotherapists, occupational therapists, pharmacists, to top of license. What does top of license mean? It means that they do more than they were trained in college to do. And this has numerous advantages. It has a huge advantage to the patient. It means that the patients get access to specialty-led care early in their journeys. It means that they get access to investigations quicker, and it means they get access to specialty treatments, for instance musculoskeletal care, earlier in their journey, which reduces their symptoms, reduces their length of stay, and improves their clinical outcomes. So under 2021, as an organisation, we want to develop advanced clinical practitioners across the trust and in conjunction with our colleagues in primary care. And recently, Lincolnshire has agreed a pan-county strategy around the development of advanced clinical practitioners to support 2021. This is really exciting, and in conjunction with the Health Education England National Strategy for Development of Advanced Clinical Practitioners, Lincolnshire is really leading the way.
Delivers a clear and progressive strategy for the benefit of the whole community. That's the patients who need the care and those that deliver the care.